So it's my distinct pleasure to interview and speak with Dierk Scheinert, who won today the Live Award. VIVA has given the Live Award, which is a leader in vascular education since its inception, and it's really been real giants in the field that have really moved the field forward, and there's no one who's done that more than you have. So help me understand a little bit, Dierk, about how it is that you see education being best suited for the population that you educate in Europe and also what you do here, and how the LINC meeting has continued to do that in so many great ways.
Well, first of all, let me thank you again for giving this award to me. I mean, it was, of course, it's a great honor and kind of an unexpected honor as well. Yeah, so thank you very much. I think the challenge, I think in the vascular territory, we see a lot of development over the past 2 decades, and we changed also our treatment approaches to patients, which enabled us to bring through a endovascular first approach for many of our patients, which makes our treatments less invasive. And I think one of the challenges was always to bring the involved disciplines together. You know, patients are treated by vascular surgeons traditionally, interventional radiologists, and interventional cardiologists, and in our field, angiologists. So for us, it was always an important objective of our meeting to kind of create an interdisciplinary platform where everybody would like to participate, where everybody should show his best treatment options, and then bring it down to a specific patient and discuss it on a patient level, what's really the best treatment offering we can have.
So we've had this great collaboration for a long time between VIVA and LINC, and part of it is the same opinion here that it should be interdisciplinary. One of the things that we really have enjoyed over the years is the live cases that have come from your center and from your operators. Tell us a little bit about how the innovation proceeds, because you guys have really done a great job of teaching the step-by-step approach for things that we all have to adopt over time, whether it be retrograde pedal access or whether it be directly entering stents and things like that. Tell me a little bit about how at your center those things evolve and how you've been able to teach those over the years.
Well, I think in our center we always were highly interested in trying to optimize our interventional approaches for our patients. One of the advantages years back was that we were seeing some of the new technology very early with, let's say, a somewhat easier accreditation pathways in Europe, so that has changed over time, but that certainly helped. But I think it's not only about technologies, it's even more about interventional skills, wiring techniques, approaches, as you said, which help us eventually treat our patients in a better way. And our team worked on that, we published on that, and we always felt that it's important to bring it to the patients, and that is only possible by educating other doctors, our colleagues, our younger colleagues specifically. And this is why we always felt educational activities are important. And the live case format, I think if it's done in the correct way with the proper preparation, is a very powerful tool, because as I said, you bring the latest techniques, the latest scientific information down on a specific patient level. So it's not an artificial scientific communication. It is really about treating a particular patient with a particular clinical setting, angiographic findings, and it is real. And I think this is what our attendees appreciate.
So there's lots of things changing in the field, one of which is all this influx of information on the pharmacologic therapy of vascular disease, whether it would be using some of these new agents for anticoagulation and all. How do you incorporate that? I mean, that's not our traditional educational interest, but I think that at this meeting and at others, we find that we have to maintain that opportunity to train and teach the whole patient care. Are you guys doing the same thing in Europe?
Well, of course, as new scientific data are come out on some of the more on the drug side of the treatment spectrum, we try to incorporate it in our conference. It's not always easy, because it's maybe on the first view more interesting to follow a very challenging procedure and watch TV if you want. But I think it's an important point of our global view on patients, and vascular interventionalists and vascular surgeons have to really learn the latest on these options and incorporate it into their practice. I mean, we know that medical treatment is far away from being perfect. Really, I would say roughly maybe 50% of our patients get all the drugs they need. I don't know if it's better in the US, but I think there is some reluctance to really prescribe. Maybe there's a concern to prescribe too many drugs or whatsoever, but there is scientific evidence that our patients would benefit, and I think we have to get better in that field.
I think for probably both of us, we've had great mentors in our past, and we share one, which is Giancarlo, and just maybe help some of the young guys understand what the importance of having a great mentor really is, and how they might be able to seek out these type of people over their career to get to places like you are now.
Yeah, I think it's difficult to describe, and when I started my career, I had the opportunity, but I think it was more like I got the chance to work with Giancarlo. That was not really planned for a long time. It was more like an opportunity which came up, and I found it very inspiring. So I think it's a lot about the personality of a teacher to really inspire younger doctors, and then let them also the opportunity for their own development. I think that happened to me in a very good way. I could take what I learned from him, but I could take it further, and had enough independence then in my career to develop it together with my team now. And but we always stayed in contact. So I mean, there was always a critical remark from the side, sometimes not always 100% pleasant, but I mean, it keeps you awake, and it keeps you looking for the best, if you want. And I think that's what a mentor and a teacher can probably give you. And I was lucky enough to have a good mentor in that regard.
I remember him saying one time to you when I was in the lab over there, he says, if you don't publish it, it doesn't exist. And so one of the things you've done really well is to teach us a lot, but also write a lot, and to be able to share that experience with people. What would you recommend to young people who are out there getting into the field as far as publication and getting involved with actually, taking their experience and sharing it with people? What's the best approach to that?
I think you're right. It's important that we learn that we are not only doing good things, but we need to learn to systematically analyze them, and to maintain a scientific approach also for our own correctness, to evaluate whether we are really doing the right things, because sometimes in these analysis things come up which you cannot realize if you are just practicing and you're just treating patients on an everyday basis. So I think it's very important. It's important for the public that these systematic information become available. It is certainly something where you have to also work yourself over a certain hurdle at the beginning. The first couple of papers are difficult to write. At the end of the day, it is something what you have to learn. And I always see that for younger colleagues, that is a threshold. So I think we are responsible to help these young colleagues to learn how to write a paper, how to do scientific analysis. And I think then once you are reaching a certain level, I think then it goes somewhat easier, I think.
Well, it's been our great pleasure at VIVA to have such a great relationship with Link and with you, and we are delighted to have given you this award, and you've deserved it for many, many years, and congratulations on you receiving the Live Award.
Thank you very much, Tony.
All right, appreciate it. Thank you.